Hi, everybody. My name's Ashley, and my presentation is going to be on communication disorders. So, for starters, I just wanted to give a little bit of a breakdown on what exactly communication disorders are. So, when we think about communicating with one another, we often think about, speaking and language, um, but it's a little bit more complex. So, the actual definition from Psychology Today is that communication disorders include problems related to speech, language, and communication. Communication disorders may range from simple sound repetitions, such as stuttering, to occasional misarticulation of words. So, um, when we think about a person that has trouble putting sentences together, or when we think of children that, you know, developmentally they seem to be okay, but then they are not forming sentences with words or the pronunciation that's correct, that could be attributed to a communication disorder. So, personally, I found this really interesting. I didn't know that this was a disorder to the extent that it would be put in the DSM. But as we'll go through, you'll see that although it is in the DSM, it's a little bit, I don't necessarily want to say contradictory, but it's interesting because it's not broken down in the same way as a lot of the disorders that we've discussed throughout the semester. So, if you look in the top right hand corner, you'll see that for all the things in reference to the DSM, I put the page number on there so that you'll be able to follow along or look in your DSM if you have one. So, I just thought that that would be helpful. So, with communication disorders, there are three different definitions that we're given. Again, it's on page 41. But this is really important because it sets the stage and it gives you the groundwork for what to expect or how to understand each of the aspects related to communication disorders, and specifically what they mean. So, I'm going to try throughout the presentation not to just read straight from the PowerPoint. Um, but for these three, they're really important. Again, just to understand the context. So with speech, it's the expressive production of sound. So that includes an individual's articulation, fluency, voice, resonance. So when you think about that, think about the different pitch in our voice. How when we get excited about something, we sound really excited and it's like, oh my goodness. Um, but, we're fluid. We can think and speak and talk all in the same time. We can articulate our words, or if there's a particular word that it's on the tip of our tongue, we know that, but at some point or with the help of others, we can kind of figure out what that word or that term is. Then you have language. That's the form, function, and use of a conventional system of symbols. So, we have different types of language. The first thing I think of is like liturgical dance. So when you have, you know, dance, they different use different sign language, or they mouth certain things. It's different types of language. We're used to verbal language. um, we also have written language. I think of hieroglyphics and pictures and things of that nature. And then also you have spoken word. So I think of like poetry, things like that. So there's all different ways to communicate. um, and sometimes there are other forms of language that we don't even think about. And so, think about the unspoken words. But they are clues, or, how do you say, like social cues maybe that we learn as, we're children and as we get older. So when I thought of language, I said, the universal high or happiness is a smile. But for some people, if they have a communication disorder, they may not interpret that or perceive that or articulate that. And then we have communication. So that's just a basic definition to what they mean by communication. So that's just any verbal or nonverbal behavior, whether it's intentional or not, that influences behavior. So I feel like, the whole smiling would fall under that. So when talking about communication disorders, just like with any other disorder, there's a specific population, if you could say. So in breaking that down, this disorder begins in childhood, and it can affect children and adolescents. Mostly, it affects them, but for some people, it's temporary and they grow out of them, and then for others, um, it can actually affect them for their entire lives in one way or another. And so that's a really big deal because it's like, wow, how do we approach um, or treat a communication disorder in a better way than we are now, so that it doesn't necessarily impact an individual for their entire life, or so that we can reduce the way in which it's impacting them. So when I was looking up the statistics, um, I did some research. I found, like psychological websites, a lot of healthcare websites, and I found it very interesting. So as of 2016, it was found that nearly 1 in 12 U.S. children ages 3 to 17 has had a disorder related to voice, speech, language, or swallowing. So I found that really, really interesting because it's like, wow, you don't necessarily think about these things until they impact you, but it's more prevalent than we may believe. And then as of 2018, Psychology Today updated their website, which stated that nearly 6 million children under the age of 18 have a speech or language disorder. So when you think about that, there are billions of people in the world, but we are in 2018 and have millions of kids suffering from some type of communication disorder or having trouble communicating with other people. And so when I thought about that, I was just like, wow, think about how we take for granted, communicating, whether it's in class, it is over the internet, or, an online class. And I often say to myself, I know my brain is working, but I don't think about speaking, or I don't think about what I'm going to say. It just kind of flows. And then it's like, wow, how do these words just come out of my mouth? But then you realize that there are some people that really have trouble with that, or have trouble understanding from the auditory perspective, or, understanding the social cues. So when looking at the prevalence, it's amazing. And then also that we talked about comorbidity throughout the semester, but then to think about, what if there's a child that has multiple communication disorders? And so the statistics on that is that there's 34% of children between the ages of 3 and 10, um, while there's 25.4% of those ages 11 to 17. So just think about that in terms of the number, like 25% of the individuals, a quarter of the individuals between the ages of 11 and 17 that have at least one communication disorder also have another one. So some of the general characteristics are that, you know, during their key developmental stages, children are not speaking at all, or they have limited word choice, or they have trouble grasping simple directions or naming objects. So when I was doing the research and I was thinking about this, I automatically thought of, I have nephews, and so I'll tell them, bring me the green ball. And they'll be like, here, Auntie, here's the green ball. But then I thought of, that seems like such a simple direction or instruction, as well as simple for him to say back to me, what the object is and the color. But for somebody with a communication disorder, that direction in and of itself could be detrimental, in terms of, oh my goodness, like this is so stressful, or it um exhibits so much anxiety in me. So it's really sad, and it's very frustrating in a sense because from what I've understood, there's not as much or as many treatment efforts as there could be. So moving forward, in terms of gender, it affects boys more than girls. Um, and so I wondered, is this that boys are just being diagnosed more? Because, as we've talked about in some previous lectures, boys, may be a little bit harder to deal with, or they may be a little bit more rowdy as opposed to girls. So I wondered if that played a role in it as well. And then again, we talked about the typical age is between 3 and 17. However, um, it's highest among children ages 3 to 6 compared to those ages 7 to 10. But you'll see it's a 2% difference, less than 2%. Um, and then children ages 11 to 17. And then in terms of ethnicity and race, a large proportion of the children that suffer from communication disorders are black, as compared to white or Hispanic. So, in the literature and the research that has been done, um, and I'm sorry if there's any repetition throughout the presentation, but I've realized that in terms of treatment, they really focus on trying to prevent it, um, or having really early intervention. And so, with that, every parent or the majority of people that become parents are excited to have a new child, a blessing, um, and to see them grow and the things that they learn. But it's also really important to be aware of and educated on the different developmental milestones that your child should be hitting. Because if there's ever a point that they're not, you know, reaching those milestones, just like they pay attention to if the child can lift their head, if they can roll over onto their tummy, if they're not reaching those developmental milestones in regard to um, their speech and their education, that is definitely something that is a red flag and needs to be brought up to the healthcare provider as soon as possible. And for me, I know that there's some people that maybe they just stress everything and they take things a little bit too seriously. But I would always want to be more safe than sorry, because you never necessarily know what something could be. Um, and so, with that, we'll talk a little bit more later in the presentation about treatment for this population. But a lot of what I found is that it pertains to active stimulation activities and therapy. And so that's, really just taking the time, being patient with the child, working with the child. And one thing that I want to emphasize is that it's not just in a therapeutic setting. It's important that people, all of the people in that child's life, are working collaboratively to find different efforts to help the child. So whether it's at school and they're getting more one on one or in special classes, if it's at home, reading with your children, taking times to correct them, just really being active in having stimulation for them as much as possible. So the research moving forward, when you talk about what works and what doesn't work, I didn't necessarily find things to say this doesn't work or that doesn't work, because it really is dependent on the child, how severe their symptoms are, their age, what other characteristics they're exhibiting. Because different from a lot of the things that we've talked about, there are not specific age requirements, um, or specific characteristics that a child has to exhibit so that they can say, oh, we're just going to give you this medication, or we're just going to definitely put you in behavioral cognitive therapy. It really is dependent on the child. And because we're working with children, It could be so drastically different. So it's hard to say what works or what doesn't, because what works for one may not work for another. Um, Also, and we'll talk about this a little bit later, culturally, um, there are some things that are taboo in certain cultures and phenomena. And then in other cultures, it's like, yes, this is what we're doing to deal with this. So it really just depends. However, and this goes back a little bit to what we were talking about before. You can have both individual and group activities. There's nothing to say that one doesn't work or the other one works. Um, and those when you have your child meet with a speech language pathologist, they may focus, whether in an individual or a group setting, on some of these skills here. So boosting phonological awareness skills, understanding inferences, using strategies to improve reading comprehension. And, those all come from the education of the speech language pathologist, and just finding different ways to help build these skills, or to emphasize, or find different ways to almost change the behavioral thought, or how a child is understanding their communication disorder, so that they can understand it, because a lot of times kids don't. And then understand how to work with it, and realize, when they are wrong, and how to fix those things. And so then causes, like everything, there could be environmental factors, there could be biological factors. Um, you see here exposure to poisons, toxins, especially during pregnancy. So it's really important from the time that a couple or a woman conceives, just to be really cognizant of what she's around, what she's exposed to, and then, what her children are exposed to, especially once they're here, but even prior to that. But brain development or gene problems could also be causes. So, going into the DSM a little bit, we have four specific different types of communication disorders: language, speech sound, childhood onset, so that's stuttering, and then social pragmatic. And then we have the other, specified or unspecified. So, for each of them, and then don't forget, in the top right hand corner, you can find the pages. We have language disorder, we have the code 315.39, F80.9. So, I really wanted to focus for each of these on the diagnostic criteria and the key features. So, we have for language disorder, persistent difficulties in the acquisition and use of language across modalities due to deficits in comprehension or production that include those three. I'm sorry. And so when I read that, I really understood that pretty much as it says, but just difficulty in just getting the language. So I thought about how when I was in high school and college, we had to take languages, and for some people it was just really hard for them to understand the language, to acquire it, to get it, and for it to stick. But for them it was a second language. And then, when learning about communication disorders, just think about it in terms of just trying to speak, or just trying to communicate at all, and having a problem, or difficulty finding a way to articulate yourself, or to have a language to communicate with other people in any way. Um, and so you'll see it says reduce vocabulary. So when you think of somebody that really doesn't have a good, I guess you can say, word dictionary or vocabulary for themselves, trying to find, the proper term. Um, and then limited sentence structure. So being able to put words together in a way that it forms in articulate sentence, but a sentence that, you know, is informative, it makes sense, and it's a full sentence. And then impairments in discourse. So that's just the ability to use vocabulary and connect sentences to explain. So, you know, um, I thought of that as I went to the store today, or my mom and I went to the store today to get green beans. Really just bringing everything together, connecting it. Um, and then going back to the modalities for a minute, I didn't emphasize that earlier, but again, that's just all of the different types of ways. So just the spoken language, the written language, the sign language, and those are the things that are affected, just essentially communicating, period. Um, and so then you'll see this in the criteria for all of them, that language abilities are substantially and quantifiably below those expected for the age. So really just going along with what we were talking about earlier, every child or every individual has developmental stages, um, and abilities that they should be able to hit by a certain age. And so really just paying attention to, are they below where they're supposed to be? And you'll see this for all of the disorders, the language abilities, the onset of symptoms being in early developmental period. Those are all really, really important. And then for this one, difficulties are not attributable to hearing or other sensory impairment. And so that's really important because you'll see that when we talk about it later, a lot of times one of the assessments that's done is a hearing test, because when there are hearing issues, that can affect the language or the way that we are interpreting things and then spitting them back or speaking, responding. For me, I thought about, in trying to relate it, I thought about, think about when you go to the beach or you're in a pool and you get water in your ear and you really can't hear, and you start trying to talk and you can hear, or even when you get off an airplane, you can hear that you're saying something or somebody's saying something to you, but it's really, really hard to communicate, or you might be yelling or thinking you're speaking regularly, and you can't really make it out because your ears are clogged or you can't hear. So that's that. Um, Developmentally, um, it is an onset in childhood. Here we talk about toddlerhood, all the way to the adult level. But really, by age 4, that's when individual differences in language are more stable. So you'll really be able to tell. So specifically for language disorder, the prognosis, it's very uh, heritable, I believe is how you pronounce it. So, um, if one family member has a history of it, it's very probable that somebody else may have it as well. And then it can just be difficult because children that do have these impairments, often they're resistant to treatment. They have difficulties with reading comprehension, so it's just very difficult. Specifically for language disorders, there are a bunch of different assessments that could be utilized: standardized assessments, language sampling, systematic observation, and they all have similarities, but they may test something different. But I didn't particularly give the details on them because they can all be, you could do like a partial assessment, you could do a full assessment, and it again is dependent on the characteristics or the severity of the symptoms that the child is showing. Um, and this may also be a result of diagnosis or a pre assessment from a psychologist or a speech language pathologist. So, really, is just depending. And then you have treatment. So, there's behavioral treatment, language treatment, as well as narrative intervention. So, just speaking one on one with the child, having interactions with family members, and things like that. And then there's differential diagnosis, normal variations in language. Maybe sometimes kids are just having a slower developmental stages. And that also goes with language regression. There could be neurological disorders. And again, we talked about the hearing. So moving forward, we have speech disorder. This really pertains specifically to the sounds and articulation. And so, moving into the diagnostic criteria specifically for this, it's that the child has persistent difficulty with, again, speech sound production, and that interferes with speech intelligibility or prevents verbal communication of messages. So, if they can't sound things out, um, and they can't articulate their words. So, I read that, you'll have a child that's like, um, oh, they're trying to say the word table and they say Babel. Even upon being corrected, they'll say Babel, because they just can't articulate or sound out table. Um, and so then also you have, the disturbance causes limitations in effective communication that interfere with social participation, academic achievement. And so, that's where you see that it starts to really impact your social life, or you getting along with other people, or you doing well in programs in school and work. And then again, onset of symptoms is in the early developmental period. And then this one is really important. The difficulties are not attributable to congenital or acquired conditions such as a cleft palate. Because, if we have maybe a deformity or something else that could impact um, our speech or whatever we're trying to get forth, that could, you know, be what's the term I'm looking for? Basically, like an obstacle in the way. When you think of someone with a cleft palate, that could have an impact on the way that their speech is articulated. So, with the development and course, um, everybody's articulation is a part of their developmental pattern, and that's reflected in age. However, most speech and sound production is pretty intelligible by age 3. So I told you guys earlier I have a nephew. He will be 3 in about 3 weeks. But this kid is very smart, and he surprises even me. But I've seen in watching him grow, I've seen how articulate he is in talking about the things that interest him, but even in other areas. And so I can definitely account for the fact that by age 3, the majority of speech sound is really pretty intelligible. Um, then we have that by age 7, most speech sound and words should be pronounced accurately. And when we think about it, that makes sense. By the time we're 7, 8 years old, we should be able to say words and pronounce them correctly or sound them out, and be able to say, okay, the grass is green as opposed to the brass is brain. Um, so by age 7, that should be happening. And it's just important to understand that many children respond well to treatment. But again, talking about the comorbidity, it could create a poor prognosis. So speaking of prognosis, some of the speech disorders are mild and go away over time, but for untreated disorders, this can cause anxiety, and it could become very severe. It could impact public speaking, and a lot of things that are beneficial and imperative to live a productive adult life. So then we have assessment specific for this one. So I found 3 assessments: the Denver Articulation Screening Exam, Early Language Milestone Scale, and the Peabody Picture Vocabulary Test revised. I found this very interesting, that for treatment, they talked about muscle strengthening because the speech disorder could have something to do with a lack of muscles in the facial structure. So sometimes speech language pathologists will try to do different activities to strengthen the muscles in the face. And then we have some differential diagnoses: normal variations in speech, again, hearing, structural deficits, dysarthria, and selective mutism. Almost there. Hang in there, guys. So we have child onset fluency disorder, which is also known as stuttering, excuse me. So for the diagnostic criteria, you'll see there's disturbances in the normal fluency and time patterning of speech. So um, I tried to think of an example for this one that we could all relate to, but when there's that child that you think about a child that may be nervous, and so they stutter, they may stutter. But think about this as something that it's not necessarily related to nerves. It really could be something that they cannot control. And so it's inappropriate for the individual's age and their language skills. And it persists over time, so it gets worse. Um, and it's characterized by frequent and marked occurrences of one or more of the following. So sound repetition, and that's like sound prolongations, broken words. So then, you know what I thought about? I think his name was Elmer Fudd. Was it Elmer Fudd? Well, one of the Looney Tune characters, and he's like, no, that was like the chicken guy. But anyways, that guy, he had a stuttering or like a speech impediment, which would be childhood onset fluency. And so one or more of any of those would be an indicator of that. And then you also have that there's disturbances that cause anxiety in speaking or limitations in effective communication. Because, just think about it. If you have a speech impediment or, you're stuttering every time you talk, it can be extremely overwhelming to then have to get up and public speak, knowing that you're going to have a hard time stating those words. And then, again, the onset of symptoms is in the early developmental period. And this disturbance is not attributable to something else. And this one would be a speech, motor, or sensory deficit, such as a stroke. The age of onset is usually between 2 and 7, but it occurs by age 6 for 80 to 90%. It can be insidious or more sudden. So, it could just happen or it could be more slow. And usually it's gradual, and then it becomes more frequent. So the prognosis, I found this very interesting. More than 3 times the risk in the general population among first degree biological relatives. So if somebody has it in their family, chances are somebody else has it as well. For this, assessments were a little bit more broad. So you just have like the parent-child interview, assessment of speech fluency, assessment of reactions in the speaker and listener, a lot of just broad assessments. And then treatment, there's 3 types. So you have indirect, which is like counseling, direct, which is trying to find ways specifically to change the child's speech. So maybe a different way in which they say the word, if it's slower, if it's just a different word in and of itself. And then operant, which incorporates operant conditioning and response contingency, so like reinforcement strategies. And then the differential diagnosis included sensory deficits, normal speech, disfluencies, medication side effects, because we'll see in all of the medications for everything available today, there's always some type of crazy side effect. And so that could sometimes have an influence on it. Adult onset or Tourette's. So we've reached the last one. It's social pragmatic communication disorder. The diagnostic criteria for this is very important because they have to be manifested by all of the 4 criteria. But it's persistent difficulties in the social use of verbal and nonverbal communication. And so it's broken down by these 4 things, so that there's deficits in communication for social purposes, greeting, sharing information in a manner that's appropriate. So, if you're meeting somebody for the first time, you're not just going to be like, oh, what's an example? You're not going to be like, oh, hi, my name's Ashley, and I threw up last night. Like, you're not going to say that because that's inappropriate, especially for somebody that you just met. Impairment of the ability to change communication. to match context of the needs of the listener. So for me, that's I thought about when you're on a date with somebody, say it was a blind date or even somebody that you've known, and you guys are trying to converse, and the person genuinely looks bored or they're not interested at all. Being able to take that social cue and change the communication to be like, okay, this person is not interested in what I'm saying. Let me find something else to talk about, or I realize this, so let's switch it up. Difficulties following rules for conversation and storytelling. So that's very similar, but I thought about, when you're telling a story, usually you do it from start to finish, or you do it with some excitement, or you get to the point. So if you don't really follow those rules, that's there. And then difficulty understanding what is not explicitly stated. So I thought of when, um, hmm, okay, so I thought of particularly earlier today, um, I was with one of my sorors. I'm in a sorority, and um, she was very moody. She was very moody, and then she stated that she had a funeral to go to. And so, for this particular example, I would think that, you know, a person suffering from this wouldn't necessarily understand that, although the person didn't say that they're grieving, or although the person didn't say that they're sad, that that's what's going on, even though it wasn't explicitly stated. But um, most people would understand, like, okay, you're dressed in this particular way, you're coming off a little bit irritable, and you have already stated that you're going to a funeral. Underlying, you're probably grieving, you're probably sad, or at least upset and affected in some way. Um, the deficits result in functional limitations and effective communication, social participation, relationships, academics. So again, like, it is having a negative impact on your life. Um, it started early in the developmental period, and it's not attributable to medical or neurological conditions, or low abilities of structure, grammar. And it is not better explained by autism spectrum. And so I've learned that with this disorder particularly, but with a lot of them, they have overlap, with other things. And so that's why we may consider a different diagnosis. But no. So it's rare to diagnose this or to see this among children under 4, but between 4 and 5, most kids have adequate speech. And then there's milder forms of the disorder that may not be apparent until adolescence. Prognosis: family history with autism spectrum disorder, um, or communication disorders, um, or a specific learning disorder increases risk. So, maybe there is a relation to autism spectrum, but not particularly sure. For this, they do assessments with speech, language, hearing, for the reasons we said before, and then comprehensive assessments. And then for treatment, there's 2 different things. So there's modalities. They focus on augmentative and alternative communication, computer-based instruction, and video-based instruction. And then there's behavioral, peer mediated or peer implemented, and social communication. And then the differential diagnosis, again, autism spectrum, ADHD, social anxiety disorder, or intellectual disability. And then when we have the unspecified communication disorders, that's really just similar to the other ones. It doesn't fit into any of the other categories well. So, one thing that we've talked about a lot throughout the semester, and that's very important in the field that we're studying, is cultural considerations. And so, across cultures, communication styles could vary, and be completely different among groups. And what I thought of, which was very important, was bilingual individuals, or people that English is their second language. Developmentally, that could cause an issue, or be more problematic if they're more fluent in one and then now they're having issues with another. I knew somebody one time that was fluent, in Spanish, but then when it got time for them to speak in English, they had such a hard time and they would stutter. And it wasn't even necessarily because they were learning the language as secondarily, because they learned them simultaneously, but it was just like when it came to English, there was a communication disorder. Also, religion. I'm sorry. There's a cultural overlay as to what's considered normal. So, we talked about society just deems a normalcy to certain things, but what is normal really? And so there's cultural stereotypes. What may be normal in one culture could just be totally taboo in another culture, or they say that if you come down with a certain disorder or disease, the devil struck you. So there's a lot of different cultural stereotypes, and that also speaks to the religion or beliefs. And then I found this interesting, that research showed that there needs to be assessments and treatment protocols that are culturally fair and effective for language disorders. And that was back in 1997. And so, when you really think about it, that wasn't that long ago, 20 years, 21 years ago. And so when you have intervention, I just threw this in there because it really speaks to how culturally things are very different. And so for Kenya, they suggest that you have to look back, you have to look current, and you have to look in the future to really understand how to intervene and how to provide treatment for the individual. And then based on this, they propose or they follow 9 guidelines to intervention. So from a cultural perspective, I just thought that that was really important. I just threw this other slide in here about assessment and treatment just to say that, although there are distinct differences that separate each group or communication disorder, there are several characteristics that overlap. And so they have similar assessments in that, they're referred to the speech language pathologist or a psychiatrist, and they may be given a full evaluation, which could include any of the individual tests that we named earlier, but also just on a general sense, it could be psychological testing, thinking abilities, psychometric testing, and again, hearing testing. That's a big one. And then for treatment, it really just focuses a lot on the individual, but really from a team or collaborative effort. So, working parents, teachers, mental health experts, the speech pathologist, everybody working together. And then it could be in individual or group support settings for that child. They may have special classes and then particularly at home activities, but I really thought about this as we were going through, and really just stimulating activities anywhere. So, working with the child, reading regularly, speaking in short sentences, and correcting their grammar. So, if they said, um, here is the blue ball under the Babel, you could reinforce it and say, thank you for giving me the blue ball that was under the table. So that you're not necessarily correcting them, but you're still letting them know in a sense that they were wrong. So these are the resources that I used. And here's our case vignette. Jacob is an 8-year-old black boy who lives in a loving home and attends school regularly. Although he is extremely intelligent, his performance in school is stifled because of his inability to produce articulated sounds in his speech. His sentences often have words that are pronounced inaccurately. Just last week, he scored low on a test at school and was laughed at by other kids because his pronunciation of the sentence, "the green car is under the table," came out as "the yin car under la Babel." Jacob may suffer from. Also, this is the handout. I think it's going to be a different link, but you guys will be able to access this and see this. And here's your discussion question, which this will be, on the board as well. But unlike many of the disorders that we have talked about throughout the semester, the DSM-5 does not list any specific population factors for communication disorders, such as prevalence rates, and factors relating to diversity, such as gender, age, or race/religion. So, just as a side note, all of those statistics and the things in terms of prognosis, prevalence, the age, the gender, ethnicity, all of that was based off of research that I did, but none of that was listed in the DSM. And when you look at other things that we've learned, that's all there. So, do you feel that this is something that should be incorporated into this section of the DSM? Also, there's definitely a lack of findings and research on alternative ways to treat communication disorders. If you were to try to implement a new treatment method for communication disorders, what would it be and why? Thank you guys so much for watching. I appreciate it. Let me know if you have any questions and have a good day.